Hello there again. I'm Erin Dean. I'm a pelvic floor physical therapist and sexuality counselor in Austin, Texas, and I work mostly with cancer patients. I am going to talk to you about graded imagery techniques in order to regain some sensation in your breasts or nipples, and maybe even arousal abilities in those areas. So recreate those erogenous zones that you're missing. So I have a lot of patients, and I'm sure if you're watching this video, you would identify with this, but you come in and you've had a mastectomy, maybe even a nipple sparing mastectomy, but you've lost sensation in your breast and your nipples even so. Some people don't have that big of a challenge with this, but especially those who felt a sexual stimuli from this area of their body, or if they felt like their breasts or their nipples made them feel like a woman and made them feel sexual, it can be really challenging when all of a sudden you've lost that erogenous zone, right? So there is a technique, a graded imagery technique that's been used for years for people who've had strokes, traumatic brain injuries, to reawaken a body part or reduce pain in a body part that has been affected by that stroke. And this technique can also be used so we're trying to create new gray matter in the brain through this technique, and that gray matter in the brain would then be associated with the breast or the nipples. It's pretty amazing how the brain works and has that neuroplasticity to allow this shift to happen. So there are 3 parts to this program, all right? Part 1, and you can do part 1, part 2, and part 3 all at the same time, or you can do them one after another, and I'll describe when you would choose to move to the next part. Part 1, okay? We're imagining that this is a breast and this ring is the nipple, okay? So part 1 is sensation. So you would use your finger, and if you have both breasts lack sensation, you would just do this one at a time. If only one breast lacks sensation, you're actually going to do this on the breast that does not lack sensation first. So do it on the breast that you can feel first, okay? And then you do it on the other one. So we'll say this is a breast we're doing it on. We use our finger and you move slowly from the outside of the breast, slowly in towards the nipple, okay? You can use your fingers, or I would try it with your fingers first, where you're actually going outside, slowly moving in and stimulating the nipples. And as you're doing this, you're imagining that, so if this is the left breast, I'm saying, here's my left breast. I'm feeling my left breast. If it's your right breast, you say, this is my right breast. I'm feeling my right breast. There's the importance is that the gray matter in the brain associated with sensation and movement are one side or the other. So it's helping to kind of create that matter where it goes. All right, so we do it with the finger first, outside to inside. This is my left breast. I'm feeling my left breast. And then you can do that same thing with, say, a feather or a piece of ice, some other sort of stimuli or stimulus, and you would do the same thing, moving from the outside slowly to the inside. Even if you're not feeling it, you're still naming the breast, which side it's on, and you're imagining that you can feel it, okay? That's step 1. So we're just trying to regain sensation, and we can actually also regrow nerves if they've been stretched or cut. In some cases, nerves can grow back over time, and stimulation to the area can not only increase blood flow, but also help the nerves grow back a little bit better, okay? It's a complicated thing to explain, but so we're basically trying to speed that process up. And if it's not going to happen, if the nerves aren't going to regrow, we're at least repatterning the brain. All right, so we start with sensation. Once you can feel it, or you're starting to feel something, you can move on to step 2. Step 2 is you're actually using a stimulus on another body part, maybe your genitals, if that's arousing for you, and you're stimulating your genitals. You can do this with a hand or with a vibrator to create arousal in yourself. So you're using another body part you're using another body part to create arousal. You're doing that at the same time as you are touching the breast and the nipples, okay? So we're touching the breast and the nipples while you are arousing yourself in another way. So you're imagining, so you're feeling the nipple and the breast, and you're imagining that this arousal is because you're touching your breast and your nipple, okay? So you're getting aroused. In your mind, you're thinking, my breast, my nipple, how arousing, okay? You do this for a while. Step 3 is you do the same thing in front of a mirror. This is the most powerful step. So you are using a mirror. Imagine the mirror is here. The mirror, I cannot see anything below my waist. I can only see above my waist. I can see my breasts. If you don't want to see your face, if that's distracting, then just be able to see your breasts in the mirror and nothing else. But you don't want to see what you're stimulating, okay? So if you're stimulating genitals, I don't want you to be able to see your genitals in the mirror, just the breasts or the breasts in the face. And what you do is you self-stimulate, same thing with your hand or with the vibrator, and you're looking at your hand, your other hand, stimulating your nipple and your breast. And again, you're thinking, this is really arousing. My breast, touching my nipple is so arousing. You're imagining that pleasure that you're getting from arousing yourself in another body part is because you're actually touching the breast. So that is the third part, okay? Again, you can do all 3 of these things at the same time, meaning like within the same week, or you can do step 1 until you gain sensation or a little bit of sensation comes back, then 2, then 3. That's also okay. I've had patients do this and come in without sensation in the breast. They leave, they start to feel again in the breast, and they start to associate arousal with that stimulation of the breast. So this does work. It's not fast, so give it some time, but it's pretty amazing to be able to recreate part of your brain to associate with that breast that no longer has sensation. And you have some power here. So how lovely is that? All right, good luck to all of you.